As a public health major, I have learned about how health systems have manipulated marginalized groups of people for research purposes, like the Tuskegee syphilis study in the 20th century, in which the American government denied poor black men of treatment for syphilis to analyze the progress of the disease. I believed that Tuskegee was an isolated case of exploitation, but I now know that medical abuse on people of color was occurring long before Tuskegee and continued afterwards as well. Many stories of those who have suffered at the hand of medical science are untold. Silencing these stories erases the pain experienced in the creation of medical knowledge. Discovery is not solely about the discoverer, and we need to consider the stories of the subjects to gain a broader understanding of power relations in health systems. One of the earliest records of exploitation is the use of African Americans in antebellum medical clinics during slavery. James Marion Sims is one physician from the 19th century who is remembered as innovative and progressive, and earned the nickname the father of modern gynecology. He performed surgeries repairing vesicovaginal fistulas, which is a hole between the bladder and vaginal wall. People rarely recognize the fact that Sims operated on over 12 enslaved women. One woman, Eryka, was operated on over 30 times without anesthesia. This was because 19th century doctors believed that African Americans had higher pain tolerances than their white counterparts. Scientific racism was used to justify these experiments and assert superiority over minorities. We can analyze the exploitation of people of color with Harriet Washington's comprehensive book, Medical Apartheid, which describes medical clinics from Sims' time period. Many publications during this time, and for centuries to come, were an opportunity for physicians to further their career. Because medical journals were accessible only by other physicians, this further silenced African Americans, and for physicians, their findings, quote, displayed an unself-conscious disregard for black patients' consent, unquote. Unfortunately, Sims was not the last doctor to exploit marginalized groups of people. This happened again in 1946 when Dr. John Cutler led an experiment in Guatemala to investigate the use of antibiotics before exposure to someone with syphilis in order to test if the antibiotics could be used to prevent the disease. Cutler's team infected thousands of prisoners, mental asylum patients, and prostitutes with syphilis, using various invasive methods, all without their consent. After 2 years of several failed attempts to collect data, they terminated the study. Dr. Cutler passed away in 2003, and his obituary described him as a beloved professor. The Guatemala papers were hidden until Professor Susan Reverby discovered them in 2010, which led President Obama to administer an apology. It's important to remember that the women that Sims experimented on did not get an apology. This is yet another example of realizations made posthumously, similar to the case of Dr. James Marion Sims. The implications of experimental and exploitative practices have lasting impacts on society. The suffering of Dr. Sims' slaves and the participants in the Guatemala study should be recognized just as much as the accomplishments of the researchers who led their studies. Correct portrayal of contributions from subjects and doctors is important because these histories have greater implications for power dynamics between doctors and patients, and between the health system and marginalized groups of people.